right, everybody, good morning and welcome to class. So you all are here for the American Heart Association Basic Life Support Instructor course, and welcome. My name is Eunice. It's a pleasure to have you here. I always start off with just like building safety, and I want you to do the same with your students. And so whenever you walked in, there's our one way in, one way out. Restrooms are all the way down the hall, and if you need me to guide you, usually I can walk you down, or I can just point from the hall and get you to where you need to be. We do have coffee and a nourishment station inside the business, and also some water. So if you need anything, you're at home, we welcome you. You can just get up and get what you need when you need it. All right, and so I always like to begin with the why. Like, why are we being a CPR instructor? Why are we being a basic life support instructor? And it's not just because, oh, we have to do it as a requirement to work. You actually have a reason, like what's your why? And so I try to give a different why each time. And my why is because I love seeing your imaginary light bulbs finally come on. It's like, okay, you're nervous, you come to class, you don't know what to expect, and then it finally makes sense. You come to your monitoring session, and then it finally makes sense. You teach your first class, it finally makes sense. And then you all don't need me as much anymore, and Mom and Eunice can go back to training the new baby. So I just love seeing you all reach your levels and reach your goals. I'm gonna ask that you go ahead and introduce yourselves. And when you introduce yourselves, just tell us your first name and the reason that you're taking the course. All right, so what about you, sir?
My name is Matthew, and I'm just taking this course because I want to be able to teach USF students CPR and be a CPR coordinator over there.
That is wonderful. That's a lot of responsibility, so welcome. What about you?
I'm James, and I'm teaching the course because I'm the safety manager for the base, so I'm teaching all the contractors on base.
That's a big job, so a lot of responsibility. What about you?
I'm Trish, and I'm restarting my instructor because I let it lapse.
It's okay, it happens to all of us at some point, it's okay. And so are you gonna be training, college students?
High
What's your goal?
school.
High school.
9 through 12.
That's wonderful. And then if you all don't know, it was a bill that was passed about 2 years ago that required, I wanna say 9th and 11th graders throughout the state of Florida to learn CPR.
We taught CPR, and we did the Stop the Bleed training this last year.
Very good.
So I definitely need to get this back.
And I think, if I'm not mistaken, you only get an hour to do all that, right?
Yes.
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 So I participated and I helped some schools initially because they got the mandate but didn't get real instructions. And so I went in and it was 400 students, 2 gyms. I recruited every instructor I had, and we got all those students in and out in an hour. So thank you, that's a lot of work.
Yes, it was.
All right, and then what about you?
I'm Gabby, and I'm going to be the instructor for the small private school I work at that teaches kids with disabilities.
Oh, that is so awesome, Marcia. You all so passionate about education and safety. I did not have you all sign in, so I'm going to have you sign in now. Once you have access to the ATLAS system, ATLAS is American Heart Association's portal for instructors, and I'll show you how to access that system today. You can just look at my system so you'll know how to get access to your documents. Because you all used our registration system, our roster is already generated. This would not be the case for your classes. You would have a printed document, or you could download a template and they can sign in on computers whenever they arrive to class. That's really important because if a name is misspelled or an email address is misspelled, you eat that card cost. So when I have you sign in right now, what I'm having you verify is the spelling of your name, the spelling of your email address, and if everything is correct, you'll sign under notes, not an initial, you'll sign under notes. Name, email address, and signature. As far as the business of being a CPR instructor is concerned, why else do I have a person sign in? We have American Heart Association, and then we have the fact that people will get forgetful and do a chargeback. So without a wet signature, how are you going to prove that that student actually arrived to your class? Okay, so having those wet signatures count. It's okay. His name is now Gabby. It's okay, put an arrow down there and then she can.
Okay.
All right, and Gabby will figure it out. All right, thank you.
Sorry about that, Gabby.
Oh, it's fine.
Don't tell your mom again.
I will not. She is the paper and contract.
Contracts manager.
And with whenever I sign something without reading it, I'm like, if Yolanda saw this, she would be so upset, and yet I still sign it and I'm not gonna read it. So this is part of the process. So we talked about the building, we've now had the students sign in. The agenda I will provide you in a few moments. I like to break my instructor courses up differently, because I've seen, after doing this for so many years, the different needs. And what I find is that if you haven't been using it, you've lost it. And I don't know who trained you as far as your BLS certifications, it relates to your BLS card. And so some people don't get the proper training, just it is what it is. And so I don't start my instructor courses until I see you actually perform your skills. And then after that, we can go into the actual policy and procedures of being an American Heart Association instructor. I have bad news for you, this course does not teach you how to instruct. This course teaches you policies and procedures so you can understand the American Heart Association guidelines, and so that when you're out there being an instructor, you'll actually be successful and you won't be out there doing things that are illegal. I told you my why, would you please tell me your why? Like, why are you being a CPR instructor from like your compassionate, your ethical reasons?
I just like helping people. I want to be able to step in when no one else is knowing what to do and they're panicking. That's why.
Wonderful. Trish?
Well, it's part of the curriculum for the courses we teach at the high school level for Allied Health Assisting CTE programs. And so I teach it, and my background is emergency room. I was an ER nurse, and, you know, this part of the stuff is what I'm drawn to. I like it.
I love it, love it. James, ethical, not just because the job was.
Oh, no, I love teaching. I've been weapons instructor in the military. I'm an OSHA authorized trainer, so teaching and training people is my passion.
Wonderful. All right, and then Matthew?
I just think it would be cool to like help people get that first step into like going, because they all want to like start jobs, and I know that there's like that first step of getting a CPR certification, and that's what I'm gonna get that to people.
So this summer I have an intern, and it's through this program called the Annie Roof Foundation. My intern is off on Fridays, enjoy life, intern. But I had the privilege of, usually every summer, I train all of their high school, and usually if they're in college, they're like 17 or 18 in college, and they're already a freshman or a sophomore. But I get them all in here and I teach them basic life support, so they're all certified in BLS at a very young age. And I think they even got to tour the Mayo Simulation Lab, and some of them want to be neurosurgeons and nurses and different types of doctors, so it's just so amazing. So you will be helping with all those young, brilliant minds, making sure that they can actually keep their patients and their clients safe. All right, so let's go over our quick review. You have a paper on your table. I ask every class this question. It is not on your paper. What does CPR stand for? Oh, dang it!
Cardiac pulmonary resuscitation.
All right, so table 2, what does CPR stand for?
Cardiopulmonary resuscitation.
And then I need to break it down for my students, because we could have some 17-year-olds in here. What is cardio? What organ of the body? Heart. Pulmonary, what organs? Lungs. So what 2 skills are we going to be teaching during the CPR course? What skills do we do in order to help preserve the hearts and the lungs? Chest compressions and rescue breaths, ventilations.
Quality chest.
High quality chest compressions. So let's talk about what makes chest compressions high quality. Matthew, how deeply do we compress on an adult?
1/3 of the chest, or about 2 inches.
Okay, now 1/3 of a chest is really important, because not all adults are the same size. So if you have a larger patient or a larger victim who's in sudden cardiac arrest, you can't be compressing 2 inches. So whatever the side view of that chest is, if you're only going 2 inches, you're not effective, because we have to get through the muscle, the fat, the muscle, and then the bone. And so it's 2 to 2.4 inches for a test, if you have to take a test soon, or it could be 1/3. Minimizing interruptions, James. How long can we take our hands off the chest?
Just 10 seconds.
10 seconds, 10 seconds max. Miss Trish, that's really important, because you're by yourself performing CPR, and the victim vomits. What do you do? This is a hard question.
Well, if I'm doing compressions only, I just keep doing the compressions.
Air 5. Woo!
I don't take time to.
Yeah, so you only get 10 seconds. So old school would have been turn them to their side to let their airway drain. That means you're focusing on ABC. And according to your papers, what's our new priority? It's one of CAB, circulation, airway, breathing. So when you think about this, if we have a person, you also what happened with DeMar Hamlin, he collapsed on the ground, so it's like lights out, you go down immediately. That is cardiac arrest. The electrical energy in the heart has stopped the blood flowing to the brain and the body, and they collapse. Their oxygen didn't leave their body. They still have oxygen, but it's not moving. So when you start doing your chest compressions, you're moving that oxygenated blood. What organs in the body are you trying to perfuse?
The brain.
The brain. So every 1 minute you delay in starting CPR, they lose 10% of their brain function.
Right.
So we gotta get in there. And so a lot of your students, family members, friends, they may wanna wait for EMS to arrive. We have trains here in Jacksonville, a lot of trains. And now we have fewer dispatchers. So by the time you call 911 twice, and then EMS comes, but they're stopped by a train, you're in there looking at somebody who's in cardiac arrest for probably 10 minutes. We need to make sure that we increase layperson or lay rescuer CPR efforts. They can do hands-only CPR, but if they just don't do anything, that person's going to be brain dead by the time the rescuers do come. So we can get their heart restarted by using what device, Gabby? AED. And so when the AED arrives to the scene, let's say you've never seen it before, what's the first thing you do?
Turn it on.
Turn it on, and then it talks to you, follow the prompts. We can get the heart restarted with the AED, but because there was no oxygen to the brain for so long, that person's brain dead. So going back to the statement about CAB versus ABC, when a person is alive, they could be talking to you, or they could be about to cold, blood pressure 70/40. We still focus on ABC. But once they're pulseless, our focus is not airway, our focus becomes CAB. And when the team members come, because this person had vomited, when the team members come, they can focus on suctioning, intubating, whatever they need to do to clear that airway, okay? All right, so next question. What does ROSC stand for? I'll start back with you, Trish. It's on your paper.
Return of spontaneous circulation.
You're teaching a 17-year-old. What does that mean, Trish?
That means that they're breathing and their heart is beating.
Okay,
And you have done a good job.
You've done a great job.
Don't leave
So the pulse has returned. Sometimes they may not be breathing again. We may have to intubate
Yeah.
them, but at least the pulse has returned. So that is the goal of high quality CPR. You mentioned high quality CPR. We talked about compression rate. We have not. How fast do we compress, Matthew?
100 to 120%.
Perfect. If we're stopping to give breaths, what's our ratio of compressions to breaths for a single rescuer?
15 to 2.
Ah, close. That's for children and
51.
infants. Don't, so it's on your paper. Single rescuer, all ages, is not 15 to 2 for adults. Single rescuer, let me help you out.
Oh, 30 to 2, I'm sorry.
30 to 2,
5
yes.
cycles.
5 cycles should take approximately how many minutes? 2 minutes. And then if you have help, you would switch out. If you don't have help, you keep going until you're exhausted, until the scene becomes unsafe, or until you're exhausted. All right, and so James has said 15 to 2. When do we switch to 15 to 2?
If they're intubated.
Okay, well, not just intubated, it's something else, we gotta stick with basic life support,
Okay,
so.
okay, basic, okay.
Uh-huh,
When we're talking about two rescuers.
2
15 to 2,
rescuers, 15 to 2, what age group?
Children and.
Children and infants. Whenever we press play on the video, it's going to say, hey, for pediatric CPR, if there are 2 or more rescuers, let's switch to 15 to 2.
Right.
They don't tell you why. Why do we switch to 15 to 2?
Because.
You get this, right?
Okay. Go ahead.
Because cardiac arrest in children is usually not because they have an issue with their hearts, because they're hypoxic.
Preach, sister.
Get the O2 level and you get them air and you circulate it in there and boom.
There we go.
Yeah. It's
All right,
different.
so she used the word hypoxic. Do you all know what hypoxic means?
I don't.
Oh, I'm sorry. Lacking oxygen, not enough to, yeah.
So whenever, and I know we have all these big words, we gotta dumb it
Sorry.
down, basic life
Sorry.
support. All right, so whenever a child, but you're absolutely correct, when a child or infant goes into cardiac arrest, usually it is not, the primary cause is not their heart, that's secondary. Primary cause is their lungs. So prevention is really important. You know, lock up the pools, watch your kids, don't let them put small objects in their mouth. Don't let them do Tide Pod challenges, you know, stuff like that. All right, and so once they are in cardiac arrest, since we know more than likely it was due to their respiratory system, we have to give more oxygen. When you're by yourself, you cannot be performing chest compressions, giving 15 compressions followed by 2 breaths and trying to get oxygen on your own. You're gonna be exhausted. So it's when you have a team member that comes along. 15 compressions followed by 2 breaths means that in 2 minutes, instead of giving 10 breaths to that child victim, you gave 20 breaths. You're able to give double the quantity of breaths. Minimizing interruptions we talked about our ratios. Let's see, look on your papers and see if there's anything else we need to cover. We will get to child and infant. I like to focus on adults first.
So the
Ventricular fibrillation, that's when the heart is quivering, and that's what the AED is detecting. So when the AED is looking to see if there's a shockable rhythm, it's checking for a quivering line, which is not what you're gonna see on TV ever. On TV for theatrics, you'll see a flat line. And then they're like shocking. The flat line represents no energy. The AED is designed to check for abnormal energy. And so technically you would not be shocking a flat line except for on TV.
Pulses, VTAC, and.
Yes.
Yeah,
So all that stuff she's saying is that advanced stuff for you. The
I'm sorry.
AED is gonna check. And then the AED says a shock is required, more than likely that person's in what rhythm? You just said it. For those.
Oh, ventricular fibrillation.
Yes, all right, so let's stand up, let's get into teams, and Matthew, if I keep you down here, Trish, if I keep you over here. Great.
Do you wanna do that first, or do you want?
Yeah, I can.
All right, and so I'll pass you all some bags. So here you go. And then so because the victim has to be at the very end, right, and I'll pass your bag over here too. And then just one more thing that I want to say, everybody, is for classroom purposes, we are working on top of a table. This is going to be our simulated medical or hospital bed. Whenever you're going to be conducting your classes, if your students are not tall enough or if they can't get the correct depth while they're on the table, what should you do?
Move to the floor.
Move them to the floor. And if you know that you're training a whole bunch of people who would normally be performing CPR on the floor anyway, just teach your classes with them being on the floor. And then one more thing I want to talk about is, this is going to be an adult victim. We've already assessed for scene safety. What do we check to see if there's life? What are we assessing?
So we gotta shake them and then check for the pulse.
Check for-
And then tap them.
All right, and so
And
American
talk to
Heart
them.
wants you to check for 2 things simultaneously. So not just pulse, what's the second thing?
Breathing.
Breathing, okay? I did not talk about this, and I need to talk about this. Why is a woman who goes into sudden cardiac arrest outside of a hospital, why is she more likely to die? A woman, why is she more likely to die?
How she's built.
I mean, you all don't even want to say the word because
Because of her breast
of her breast.
Yes.
All right, and so, especially male instructors, what law protects you?
Good Samaritan.
Good Samaritan law,
Yeah.
okay, so we have one here in Florida. You are exposed in the chest because you are preparing for what device? AED. If you don't have an AED, you don't necessarily need to expose the chest, but what you do have to do is start those compressions. So don't just look at a woman who is in cardiac arrest and wait for another woman to rescue her. You're going to go ahead and start chest compressions on top of clothing if you don't feel comfortable exposing the chest. Do not delay. For every 1 minute you delay, how much brain is lost? 10%. And so research has shown that because of fear of lawsuit, fear of sexual harassment lawsuits, blah, 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 men would not resuscitate a woman. And we don't want that to be a reason that a woman is brain dead. Okay? All right, so let's get you in position.
Abby, can I just come over here so I can
Yes,
see everybody?
ma'am. All right, so we've called for the AED. All right, so let's go ahead and do those 30 compressions, everybody. Hands on the chest, and let's go. 1, 2, 3, 4. Now say it together. 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 32 breaths. Hover so your partner can see. 1 and 2. I didn't do a breath so few, so refocus. Reposition. 8, 9. Perfect. 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29. Hands up. 1 and 2. Remember please, great job. You want pause? Pause. You have 10 seconds to switch, please switch carefully. 10 seconds to switch. All right, and then this time, organized chaos. All right, hands on the chest, let's go, let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, keep going, perfect. Great job. 14, 15, 16, 17, 18, 19, 20, 21, great job. 23, 24, 25, 26, 27, 28, 29, and hold. 1, and stay with it. Keep going. Over the way. 4, 5, 6, 7, 8, 9, 10, 11, 12. You walk and stop after this one.
16, 17, 18.
Great job, keep going. 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths. 1 and 2. Great job, everybody. All right, so you did a great job. And I'm going to stand up front. If I can get you all to mosey your way up front too, because we call for the AED. When the AED arrives to the scene, what's the first thing we do?
Turn it on.
Turn it on. Can we use an AED on a pregnant mother?
Yes.
Yes, we can. Dry off the chest if they're wet. You don't have to dry off the entire body. What do you do if they have a medication patch?
Take it off.
Take it off. They are a cancer patient and that's a fentanyl patch. If I don't have gloves, how do I take that medication patch off?
You don't.
You do. What's usually the trash cans?
Oh, plastic.
Plastic. It doesn't have to be sterile. We just need to make sure we protect our hands, and we can't protect our hands with clothing, okay, because it's still permeable. When this arrives to the scene, we're gonna power it on. And then the second thing we're gonna do is listen to the prompts. It's going to tell us where to apply our pads. It's gonna tell us to apply the pads. This has an illustration, some images. You would peel and stick, try to avoid the nipples and make sure that the chest is exposed so the bra cannot be there. It's also going to start flashing, and I'm going to talk this through first, and you'll understand when you become a teacher, you're talking over AED, you're losing your students. So I'm going to talk about it first, and then I'll turn the AED on. It's saying analyzing heart rhythm. Stand clear of the victim. What word do you say? One word.
Clear.
Clear. If you're touching, it's picking up your heart rhythm. This is dependent on your audience. If you're with nurses, doctors, people you trust, we're supposed to go back and do chest compressions when it says analyzing. You're with a whole bunch of high school students. Clear them and keep them clear. Don't let them come back to the scene. You're with paramedics, EMT, when this says charging, I want you to say compress. Charging.
Compress.
And then it's gonna let you know when it has fully charged, because this will begin flashing. When this flashes, if you press it while I'm touching, what happens to me? I get shocked. I'm not gonna like you, bad coworker. All right, so before I press this button, what one word do I say? Clear. Everybody's clear? We're gonna press the button, shock. Even if the shock was effective, right now his heart rate is 2. So it's not like you can just shock and take your hands off the chest. You shock and you go back and do compressions for 2 minutes. And every time this reanalyzes, that is your reminder for you to do what after 2 minutes? Because you're tired. Switch off. This person starts moving 1.5 minutes later. What do I do? No more shock is needed. Do I turn this machine off? No. Think about what happened with DeMar Hamlin. He regained the pulse, but he also lost it again. We're gonna keep this on till they get to their next destination. So for you at a college, it's gonna be paramedics. When the paramedics have theirs on, they will take yours off. Hospital or what have you, whenever the paramedics get there, that's when the hospital will put theirs on and the paramedics take theirs off. If you're in actual hospital, we're gonna probably keep that on until we fix them, and that's when we start talking about those advanced options where we can intubate and give them other medications. Gabby, I select you. You're taking one for the team. All right, and so if you can stand right here. Usually the AED person is towards the foot of the bed because we talk about those advanced rescuers. We have somebody over there starting IV. You have me over here doing chest compressions. It's going to be organized chaos. I need for you to listen to the AED, but I only listen to you.
Okay.
I'm doing my compressions, you can sit it down and then power it on, don't plug it up first. Always turn it on first and it'll tell you what to do. Press it hard. 6, 7, 8, 9, 10.
Apply pads to patient bare chest. Plug in pad connector next to flashing light.
24, 25, 26. Yeah, you get on in there. You can. 3,
Apply
4,
pads.
5, 6,
Plug in
7, 8,
connector.
9, 10, 11, 12. Are you standing fat, Gabby? Come on. 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 1, 2,
Plug it in.
4,
Analyze the
5,
heart
6,
rhythm.
7, 8. Great job.
Do not touch the patient.
Very good pad placement. When it says analyze, say compress. I'm sorry.
Okay.
Shock
Say compress.
advised.
Say compress.
Compress.
Don't move these little
Charging.
4, 5, 6,
Stay
7,
clear
8,
of
9,
patient.
10, 11, 12, 13. When it
Trigger
crosses here,
shock now.
make sure you guys
Press the
clear.
orange
Press
button
down. Okay.
now.
Now what do you do?
And press the button.
Yeah.
Shock
We don't get
delivered.
dead people say compress.
Compress.
Begin CPR.
I have no chocolate to give you, but what is the name of that tone?
Name of the tone
Yeah, the tone has a name.
is called metronome.
What? If I had chocolate, you would have it.
I would've never got that.
Yeah, I need it.
All right, so what is the purpose of the metronome?
So you do it.
Yeah, so whenever, what would you tell me to do?
Match the beat.
Yes, match the beat.
Yeah.
Whenever you're turning your AED off in your classrooms, the term I want you to say is, I'm turning the AED off for classroom purposes only. I'm turning the AED off for,
Classroom
purposes only.
your students will do exactly what they see you do. And if you turn the AED off, they're gonna turn their AEDs off. So make sure you let them know that they're gonna keep it on even if the person regains a pulse. What questions do you all have about the use of AED? Give her applause. All right, do you all need a few moments to practice or do you understand it? You understand? All right, so let's go to the second half of our class. If you need to write any notes, feel free to write some notes down.
Is
Yes.
the pad placement best way that way or this way?
This one has it going around laterally.
Does it matter?
I'm not gonna say it matters as long as you have it in the right position. I think she may have had it here. What happens is, what I'd be concerned about is when people put the pads way down here.
Yeah.
Because they're pretty much, if you think about the apex or the strongest part of the heart, it's beneath the crease. And so we're sending a shock through, so as long as it's not too far down, I'm not really worried about this or that,
Okay.
okay? All right, what other questions do you have? All right, so now we're, going from adult CPR to child CPR. According to American Heart Association standards, what age to what stage is a child?
The child is.
1 to puberty. Water signs of puberty besides attitude. Yes, yes, yes. And so what I like to think of, if you have to guess, treat them like an adult.
Yeah.
If you're spending 3 seconds on, is this a child or an adult? Treat them like an adult, because most lay persons don't compress deeply enough to begin with. What changes with child CPR versus adult CPR?
The ratio of 2 person.
With ratio of 2 persons. So you mean tell me for one rescuer, it's still 30 to 2, it's still 2 inches, we still have to minimize interruptions. I still recommend that you use 2 hands. Because let's say this is a 4-year-old, and I am not compressing deeply enough. I don't have a feedback monitor on a human, okay? I'm not compressing deeply enough, and he doesn't make it, but I was the rescuer. What am I gonna be thinking about for the rest of my life?
That you could have.
I could have used 2 hands and made sure I went deeper, okay? So that is my recommendation. We already talked about the reason that a child would go into cardiac arrest. It's usually not their heart, it would be their lungs. And so when you're teaching classes, make sure you teach prevention. Show me on your own bodies how to perform the abdominal thrust for a child or for an adult. All right, so we got it there. All right, so here we go. Avoid, what is this part called?
Xiphoid process.
Avoid the xiphoid process. So try to pretend they have, hopefully their pants are where they should be, a perfect pants line. Make a fist with your, one hand, the fulcrum or the knuckle of your thumb goes above that belly button. Cup the hand, and you're gonna do what type of thrust? Upward thrust. What do you do if the person's pregnant? Teens get pregnant too, children
Chest
get
thrust.
pregnant, chest thrust. Chest thrusts are not up, chest thrusts are in, okay? Person is now collapsed, or they're unresponsive. They shouldn't collapse because you should have a really tight grip on them. You step back, lower them to the ground, and do what? Start CPR. When would you look for the obstructing object?
After 2 minutes.
Not after 2 minutes.
When you do respiration.
So after your 30 compressions, you look in the mouth. Can you do a blind finger sweep? No.
No, not on the kid, not on newborn. No.
So if you see the object, you can carefully remove the object. If you know this person, if you love this person, you can still try to give a rescue breath. Whenever you're giving a rescue breath without a pocket mask, without a back mask device, how would you give a breath to an adult or a child?
Hold their nose up.
Hold their nose,
Tilt them back.
tilt the head.
And then
So explain this, I'm a 17-year-old, why am I squeezing the nostrils, why am I opening the airway?
escape through the nose, and then you wanna open their airway.
Lungs.
What's blocking the airway?
Their
The
tongue. If you have
tongue.
a tilt chin up, gives the
I
tongue.
love it, so you see how you're teaching me without this video? That video is only there to serve as a guide, and it teaches 75%, but when that video pauses, the students need to know that you know what you're talking about, because it's gonna be this one student who's asking, why am I opening the airway? And you're like, the video didn't cover that? So it's things that you have to know as an instructor, and so that's why I really think these reviews are important, because having that video is nice, but what if the power goes out and you have a room full of government contractors? I need you to teach your course.
Got it.
Pad placement on an infant.
Anterior
I'm sorry,
posterior.
I messed up, on a child. Same as on
Same
the,
as-
Adult, and the infant is anterior posterior.
yeah, so the anterior posterior, front and back, let's say this is a really small child, same exact thing, because those pads should not overlap. If you're in fear of the pads overlapping, you put one in the center front, one in the center back. Alright, so let's go to infant CPR. Any questions on adult or child CPR? Let's talk about opioids. Alright, so, you can go to Narcan.com, it takes 6 weeks, you can, order a free Narcan training device. Some of your fire departments may have the Narcan training kits, depends on who's in
We
your
actually have them
community.
at school in our AED box.
Very good, very good. I'm sure hopefully you all have them at the college, and if not, hopefully you can get some. Would you use Narcan on someone who is dead and you're by yourself? They're in cardiac arrest, full-blown cardiac arrest?
And the thing it didn't say, no implications, so no.
No. When the rescuers come, because they have a larger team, someone can be doing chest compressions while someone's managing the airway, that person who's managing the airway can,
Yep.
okay. Because they have to be able to inhale it, and if they're dead,
There's not gonna move it. It's not gonna move it.
all right, so it's just gonna stay in the nostril, it's gonna stay in the hair, so the plunger isn't the best, but the person who is maybe partially responsive, unresponsive, but is still breathing, you're thinking they may have had a drug overdose, you would usually have these if you were previously in a drug treatment center. Let's say you tried to detox off of something and they know that you could relapse, so they're gonna give you prescriptions for Narcan, or in your community facilities, they're gonna be having some
We
Narcan.
actually have a vending machine in Palatka.
I heard it's bad, and now we have Frank. Alright, so it's just, everybody's trying to
Yeah.
self-medicate.
So if you're unsure, you just don't use that at all, right?
When in doubt, 911 chest compressions.
Yeah.
Yeah, but if you know a little bit about this person's history,
Yeah.
you see some drug paraphernalia, nostril squeeze. You don't have to close off the other nostril. They don't tell you what happens after you give
You
Narcan.
better look out. They're gonna come up swinging, cause you just messed up their.
So I think it's such a disservice to rescuers. We're telling you to use Narcan without telling you that you're about to fight for your life.
Exactly, because they're gonna come up yeah.
Yeah.
Mm-hmm.
So if you don't feel like trying to protect yourself from somebody who's swinging, you can wait for those advanced rescuers, because usually there's more of them there. And they may have some handy dandy things called restraints.
Yeah.
All right, so let's get out the infants. And you can just stay where you are, and I'll bring the infant to the front table. I like to do what I call takeaways. A takeaway is something you've learned or something that's been reinforced. And when you think about the BLS classes you've had in the past, what is a takeaway from what you've learned this morning? You can, anyone can start. Something you learned or something that was reinforced.
Oh, terminology, for sure, for me. Yeah.
Very good, very good. What about you, Trish?
Well, I'm gonna tell y'all something gross, because back in the Stone Age, when we first started doing this, we had to do mouth to mouth. And what nobody ever told us was, there's nothing worse than 2-day-old lasagna in your mouth.
In your mouth.
We had no face shields, we had nothing. Pocket mask, no, I have nothing.
I feel like vomiting right now, Trish. Thank you
I'm
so
sorry,
much.
I'm sorry, but I'm telling you, I am so happy
We
that
have
you
these
have.
devices now,
Yes,
yes.
and you're not cleaning out the mouth and you're continuing to go, because that's not how it used to be.
So when you're teaching your classes, the American Heart Association still wants you to teach, well, the video shows mouth to mouth. No one should be doing mouth to mouth in your class. But in your classes, they will have a pocket mask and a one-way valve. Because we're just doing a review and you should be using these items in your actual BLS course. We did not pull those out today, but in your classes, you wanna have the pocket mask and the one-way valve. Letting your students know that that one-way valve does not protect them against COVID. It protects them against 2-day-old lasagna. All right, please give us a takeaway, Matthew.
I didn't know that you could remove the fentanyl patch with plastic, so I was like, stay away from that, but I didn't know that you could do that.
Yes, you certainly can. And what about you?
I appreciate the directions on the AED.
Very, and you did such a good job. All right, so everybody, if a child or an infant, excuse me, now we have an infant, someone who's less than 1, if they go into cardiac arrest, what was the cause?
Usually breathing.
Usually obstructed airway breathing. The video's going to go through this so fast. The video's going to say that if a child or infant has a heart rate less than 60 with signs of poor perfusion, you need to start CPR.
Yes.
What are signs of poor perfusion in someone who's brown?
Nail this.
Yes.
I don't know.
So it's probably just easier
Easier than nails.
because we have different shades of brown. What a lot of your textbooks do is they will say cyanotic or turning blue. Dark-skinned Asians, dark-skinned Hispanics, African Americans do not turn blue. So you want to look at the hands, okay? You can look at the palms. Palms should be pink. The nails should be pink. If they are any other color and their heart rate's less than 60, you start CPR even if that child or infant is still moving.
So if they have their nails painted, would you just go off the palm?
I will go off the palm and then how the child is presenting. And when in doubt, who's on the phone with you? 911. Okay, all right, so please tell me how to help a choking infant. James.
Turn all those back, and then we're gonna have 5 tests.
Okay, and if I did have a seat, I could use my leg for support. And a lot of people are like, oh, you should do that sitting. What if there's no chairs nearby? You all save the baby. I am not, my hands are not together, I'm not suffocating the baby. I'm just supporting that head because it likes to go forward. And you said just hit them 5 times? Like this?
No, push forward.
Like push forward. So I'm actually dislodging.
Dislodging.
1, 2, 3, 4. Why is the head lower than the diaper?
Gravity.
Gravity. And what do I do now, James?
So then turn it back over.
Okay, and
For
we have,
support,
for support, okay, I got him. And now what do I do?
then you're gonna do 5 on the chest.
Like this?
No, down. 2 fingers, I'm sorry.
2 fingers, there we
Yeah,
go.
2 fingers, yeah.
1, 2,
Yeah.
that's okay, James gonna save him. You're gonna be a little injured, but James
No,
gonna
no,
save you.
no.
All right, and so, what finger do I use if I see an object in the infant's mouth? Do I want to use my index finger? Pinky, smallest finger. Look at you men, look at the size of your index finger versus the size of your pinky finger. Poor baby. Yeah, poor baby. Use the small finger and do a sweep. If you have students who have fingernails, just be mindful that maybe they should not have long fingernails if they are taking care of kids. We don't know when an emergency is going to happen. But what I do know is if you have a long fingernail and you're trying to get out an object, you're going to cause more damage from that fingernail than probably what they choked on.
Especially they got curly ones.
Yeah, and like coffin nails and everything else. Here you go, baby's choking, show us what to do, always start with the back thrust first, back blows first. Alright, so let me help you out here, straddle, straddle, there we go, and pretend you're sitting, let's go, 1, 2. She's not playing, it looks barbaric, she's not playing, but she's effective. 2, 3, 4, 5, let's go again. Alright, everybody sit the baby upright so you can look at his or her mouth. Show me which finger you retrieve the object with. Baby
Does it
now
matter
has
if
a
it's
strong
your
cry.
hand or not?
It doesn't matter, because you're probably holding it with the dominant hand. Baby has a strong cry now, what do?
Assess breathing.
Assess breathing,
Assess their
get,
hand.
get the baby to a medical facility. They need to be seen because the baby may not have just swallowed one item, they could have swallowed 2 items. Or when we were getting the object out, we could have caused damage. So it's always good to have the baby seen. Pass your babies down to the next team members. All right, let's start with our back thrusts or back slaps. Let's go. Great job. Support and flip. All right, good. And no bouncing, James. Just stay there. 2, perfect. 3,
We don't
4,
want shaking
5.
baby syndrome.
No shaking baby syndrome. Let's go one more time for me. And then after this, you all have really bad news. Your baby stopped moving.
Wow.
Wow.
Yeah.
Your
Well, I'm
baby
going
stopped
to-
moving. So I'm gonna put this baby
on
here.
that surface.
And James, may I take your baby?
Mhm.
All right, and so if you'll go back to your original teams.
Okay.
All right, so we tried to get the object out and it did not happen. So rescuer number 2, you will have the back mask device. Rescuer number 1 is going to be the compressor. Rescuer number 2, do not delay. Pick that mask up, put the mask on the infant's face. Do not use your leg. Rescuer number 1, you're gonna have the 2 thumb encircling hand technique. So it's gonna be like this. You're gonna wrap those hands around. All right, and it's 2 rescuers, so what's your ratio?
15 to 2.
15 to 2, 15 to 2, let's go. 1, 2, 3, 4,
4,
5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 2 breaths, 1 and 2. Remember to lift those thumbs. Let's go again.
3, 4, 5, 6, 7, 8, 9, 10, 11,
Great job.
14, 15.
13, 14, 15.
All right, and then after this one, you all, you have pause for classroom purposes. It's 2 minutes. Let's switch out. Okay, let's go ahead and switch. Compressor, start compressing. Airway person, get in place. Count together.
4, 5, 6, 7, 8, 9, don't put 2 fingers off.
12, 13, 14, 15.
Good job. 1 and 2. Let's go again. You don't need to wait for baby, but you keep the airway open the whole time. And everyone can stop. Great job. I see the chest rising. You all did a miraculous job. All right, so now we're back up here. We're on the last station. The AED just arrived. Matthew, come on over. All right, I'm going to be doing chest compressions. Turn it on. Press the button hard.
Apply pads.
Doesn't matter which one goes
Position
where.
their
Great job.
chest. Plug in pads connector next to flashing light.
22, 23, 24, 25, 26, 27, 28, 29, 30.
Analyzing heart rhythm.
I will listen to you.
Oh,
Do
okay.
not touch the patient.
When it says, shock advised, tell me to
Shock
press.
advised.
Good job. 1, 2, 3,
Charging.
5, 6, 7,
Keep
8.
pressing.
Stay clear of patient.
Wait, no, keep going, keep
No, no,
going.
you're right, clear.
Deliver shock now.
Clear.
Press the orange button
Clear.
now. Shock
Start.
delivered.
Start
And now let's
compressing.
switch, let's go.
Begin CPR.
What's the name of this tone?
Metronome.
And who starts with now?
Very good,
I
everybody.
got
Give
it
them
now.
applause.
I'm not gonna forget that now.
For classroom purposes only,
Turn off.
Turning it on.
turn off the AED.
Turn off the
How do you all feel? We did a review for adult, child, and infant. We've talked about choking for all ages, we've talked about Narcan, we've talked about the AED use. Do you have any questions before we really start the rest of our BLS instructor course?
So you said Narcan, you said you only give it if you like suspect
If
At
you
all.
know their history, like, 'cause
Yeah.
most of us are not just walking around, regular rescuers are not walking around with Narcan.
Yeah.
Yeah, so it would usually, in my instances, it'd have to be, I'm in the house with somebody who already had it prescribed,
Mhm.
and I know they have it prescribed, because we just don't have Narcan freely like that.
Mhm.
If in doubt, use it, worst case happen scenario, nothing happens, you already have 911 en route, but it's just like, where are you gonna get it from?
Cause I would be teaching EMS students that they're like on the EMR, like, thing, so, and we would
Follow
have,
your medical director.
okay,
Okay, so
Okay.
whenever those higher level questions, things like that, because you all are gonna have pulse oximetries, you're gonna have more equipment
Mhm.
than it's just me and my eyes and my hands. So, yeah, I would really pose that to the MD,
okay.
okay? Any other questions for you all?
So you said nothing happens if you give it to them and they didn't need it?
Yeah, because it's trying to bind up opioids. So if they're using something that is not that type of narcotic, it's not gonna be effective. And if they don't have any narcotics in their system at all, it's not gonna be effective. What's gonna be effective is people like you actually assessing their breathing. If they are, you found them on their back, they're struggling to breathe, do we keep them on their back?
No.
Do you sit them up?
Sit them up.
No,
No,
no, to the side.
Turn them to the side.
Okay.
Because if you sit them up, what's gonna happen to their head? You sit them up,
Moving all over.
exactly, they're gonna be dizzy. But you don't want them on their back because chances are they will vomit.
That's great.
And that is first aid. I do wanna just, say one more thing. If you noticed how whenever something's above my pay grade, I refer it to the person who's above my pay grade. So when you're in your classes, I teach a lot of people. If it's not American Heart Association curriculum, basic life support, I'm gonna say for this class, regardless of my certifications, it's above my pay grade. And that's why I would defer it to someone else, because your students are brilliant, they're gonna ask you all kind of questions. They're gonna ask you about the AEDs. Do you make AEDs?
Nope.
No. I can tell you how this training device works. I can tell you how basic AEDs work, but when you wanna know the specifics of a certain type of AED, I need you to contact that manufacturer, okay? All right, everybody, great job. All right, so we're gonna go ahead and finish up our class, and we'll give you a quick restroom break.